Menopause after 60. What women need to know about symptoms, risks, and relief. Now, if you don't prepare, it's too late. Hello, and welcome. Menopause. The word itself often brings to mind a specific age, perhaps the late 40s or early 50s, and the idea that its journey concludes neatly around age 50. But what if I told you that for many women, the story of menopause and its profound effects on health and well-being continues far beyond that perceived endpoint? What if the symptoms, the changes, and the crucial need for informed care extend well into their 60s, 70s, and even beyond? This isn't just about an occasional hot flash or a sleepless night, it's about persistent symptoms, significant health shifts, and the ongoing need for empowered management. This video is for you. Whether you are actively experiencing new or lingering symptoms, seeking to understand your body better as you navigate this phase of life, or simply wanting to be well informed for the years ahead, you've come to the right place. We are here to support your next chapter. We will explore what truly happens after menopause, why understanding its impact after 60 is not just important, but essential, and how you can stay healthy, informed, and truly empowered. Let's embark on this journey together, armed with knowledge and a deep sense of self-care. The journey of menopause, or more accurately, the menopausal transition, often begins subtly, leading to the point where periods cease. Medically, menopause is defined as the point when a woman has gone 12 consecutive months without a menstrual period, typically occurring around the age of 49 to 50 for Korean women. However, this is not a sudden switch but a gradual process. The term, perimenopause, describes the period leading up to menopause, during which ovarian function gradually diminishes, causing hormone levels to fluctuate and bringing about a range of symptoms. During perimenopause, hormonal shifts can lead to irregular menstrual cycles and varying flow. It's estimated that a remarkable 90% of women experience some form of menopausal symptoms during this time. These can be acutely uncomfortable, think hot flashes, night sweats, and sleep disturbances that disrupt restful nights. There are also systemic symptoms like generalized muscle and joint pain, along with emotional changes such as anxiety, irritability, and depressive moods. As women fully transition into menopause, these symptoms can evolve. The decline in estrogen leads to subacute issues like genitourinary syndrome of menopause (GSM), which includes vaginal dryness, recurrent infections, itching, and painful intercourse due to the atrophy of the genitourinary system. Libido can also decrease. Beyond these, chronic and potentially more severe health concerns emerge. Bone loss accelerates, increasing the risk of osteoporosis and fractures. Cardiovascular and cerebrovascular diseases become more prevalent, and cognitive changes, including memory issues and an increased risk of dementia, can also be observed. This profound hormonal shift means that after menopause, the body operates under a new equilibrium, and understanding these changes is vital for maintaining long-term health. The significance of managing menopausal symptoms and their broader health implications after the age of 60 cannot be overstated, especially in our aging society. Women are now living longer, with more than 1/3 of their entire lifespan spent in a postmenopausal state. This means that the decisions and lifestyle choices made during these years significantly impact the quality of life in later decades. After 60, the risks of conditions like osteoporosis and cardiovascular disease become more pronounced. Therefore, it is critical to engage in regular medical checkups, maintain a balanced diet, incorporate consistent exercise, and carefully consider the benefits and risks of hormone therapy in consultation with your healthcare provider. This proactive approach ensures that your later years are not just longer, but healthier and more vibrant. Managing menopausal symptoms and maintaining health after 60 involves a multifaceted approach, combining smart lifestyle choices, medical interventions, and self-compassion. Let's gently explore each area. First, lifestyle adjustments can make a profound difference. Begin with mindful temperature management. Avoid sudden temperature changes and opt for layered, light clothing to prevent overheating, which can trigger hot flashes. Your diet plays a crucial role too. Steer clear of spicy and irritating foods. Instead, nourish your body with plenty of vegetables, fruits, and fermented dairy products to ensure an ample supply of vitamins and minerals. Soy products, rich in isoflavones, are particularly beneficial and can help alleviate hot flashes. Regular physical activity is non-negotiable. Aim for at least 30 minutes of moderate intensity exercise, such as walking, jogging, or strength training, at least 5 days a week. And if you smoke, quitting is one of the most impactful steps you can take, as smoking can worsen hot flashes and even bring on menopause earlier. Finally, prioritize your mental well-being. Hormonal changes can affect brain chemistry, leading to mood swings, anxiety, and depression. Practice stress management techniques and seek support when needed. Beyond lifestyle, medical options offer significant relief and protection. Hormone therapy (HT) aims to alleviate symptoms caused by estrogen deficiency and mitigate the physical changes of aging. It can significantly reduce menopausal symptoms, help prevent cognitive decline, and decrease the risk of bone density loss and fractures. If you have an intact uterus, a combination of estrogen and progestogen is typically prescribed. For those without a uterus, estrogen-only therapy is an option. However, HT must be approached with caution, especially if you have a history of breast or endometrial cancer or are currently undergoing cancer treatment. Your doctor will carefully assess your individual circumstances. Pharmacological treatments are also available, particularly for bone health. Calcium and vitamin D supplements, along with bisphosphonate medications, can help prevent and treat osteoporosis. While natural remedies like soy and red clover are often explored, scientific evidence regarding their effectiveness remains conflicting. So it's always best to consult with your doctor. When it comes to hormone therapy after 60, the conversation becomes nuanced. Generally, hormone therapy can be used until around age 60. If symptoms persist beyond this age, continued treatment should be decided in close consultation with your specialist, considering your individual health profile. There was a time when the Women's Health Initiative, WHI study in 2002 raised concerns about the cardiovascular risks of HT in older women. However, subsequent research has clarified that for younger menopausal women, HT can significantly improve health outcomes and quality of life. For women over 60, while HT can still provide symptom relief, its primary purpose shifts from chronic disease prevention, like cardiovascular disease or cognitive impairment, to alleviating menopausal symptoms. This distinction is crucial for informed decision-making. As you navigate life after 60, remember that menopause is not an ending, but a transition, one that requires continued attention and care. The risks of certain cancers and adult-onset diseases increase with age, making regular health screenings tailored to your age incredibly important. Furthermore, with the natural decrease in muscle mass and increase in fat mass that often accompany aging, maintaining a healthy weight through consistent exercise and a balanced diet becomes even more vital. This comprehensive approach, guided by your healthcare provider, ensures that you can thrive in this new phase of life. Remember, the information shared here is general guidance. Your health is unique, and personalized care is paramount. Always consult with your healthcare professional to determine the most appropriate management strategies for your individual needs. They can provide tailored advice based on your medical history, current health status, and specific symptoms. Your well-being is a journey, not a destination, and continuous, informed care is your most powerful ally. This is your next chapter, and with the right knowledge and support, it can be your healthiest and most fulfilling one yet. Embrace it, understand it, and thrive through it. Thank you for joining us. If you found this helpful, please subscribe and take good care of your health.